Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SMS College of Technology. In this video, we are going to see about the applications of the biomedical engineering. We have seen about the applications of biomedical engineering in medical imaging system, where we saw about MRI, CT, and ultrasound. And we have seen about the diagnostic and therapeutic equipments, which are the applications of biomedical engineering. And now in this video we are going to see about the biomechanics and orthopedics. Okay, biomechanics is a combination of biology and the mechanical. Okay. Biomechanics applies principles of mechanics to understand and simulate the movement of human body. Okay, and the principle of mechanics to understand and simulate, we have to develop an output, right? That is called simulation. Simulate the movement of human body. We have artificial limbs and prosthetics. For example, artificial limbs and prosthetics can be designed using CAD and a 3D printing. In CAD we can design it, and by using 3D printing we can print it out in the 3D form in the hardware component, and that can be fixed to the patient. Either can be it can be artificial limbs or a prosthetic legs. Okay, next is the joint replacement. Engineering helps improve the materials, design and fit for the implants. Okay, in joint replacement we have to design the material first. We have to decide what kind of material we are going to use, and the design how it does exactly fits the human body. And the third one is fit of implants. We have designed a material has been fixed, and we have to implant it to the human body. Okay, either it can be either it can be knees or hip. Okay, applications. Example, sports injuries recovery and improving mobility in the elderly. These artificial limbs and prosthetics and joint replacement, this can be done during for the patients like sports injury patients, or improving mobility in the elder people. If they have some knee injury, or if they have met some accidents or something like that, if they have lost their limbs or legs, that can be replaced by the prosthetic legs and artificial limbs. And and this joint replacement, elderly people will have the joint pain regularly usually, so we can replace these things by we can replace elderly people with joint replacements also. Okay, the next one is tissue engineering and regenerative medicine. Tissue engineering and regenerative medicine, creating biological substitutes for damaging tissues and organs. Okay, creating biological substitutes for damaged tissues and organs. If we have a damaged tissues, like we can regenerate, the organ replacement can be done by 3D printing process. Okay, 3D printing process, we can regenerate the tissues and the organs. Scaffolds, biodegradable materials used to grow cells and regenerative tissues. Scaffolds, this is a biodegenerative material which is used to grow cells and regenerate tissues. Okay, the next is stem cell therapy, combines engineering system to culture and redeliver cells. The stem cell therapy, as we all know that the stem cell therapy is a very popular one, where we can recreate the organs recreate the organs of a particular person by using the stem cell therapy. Okay, combining engineering systems to culture and deliver cells. Third one is 3D bioprinting. 3D bioprinting used to create organs or tissues like structures layer by layer. These by printing exact organ and we can replace it if a particular tissue or an organ is malfunctioned or failure of the function. Okay, application for this is skin grafts for burn victims. The skin will be very, it will not be in a proper condition, right? For that purpose we can go for these procedures to change the skins. Or lab growing cartilage arthritis treatment. Okay, lab growing cartilage arthritis treatment. Tissue engineering and regenerative medicine, we have scaffolds, stem cell therapy, 3D bioprinting, and an example for these thing we have saw. Next, biomaterials. What are the biomaterials? Design and development of material compatible with biological systems. Okay, the design should be done, and the development of the same design which we have designed is that should be compatible with biological system. As I told you in already in this previous videos also, if we are going for a prosthetic leg or an artificial limbs, we have to take the patient's muscles and a nerves for developing a particular prosthetic leg or a artificial limbs. Okay, that is to be designed here. Implements and prosthetics. Titanium, ceramics, and bioactive glasses are used for their compatibility and durability. Okay, we can't just design the prosthetic legs or artificial limbs for a shorter time period also. It should lead for a very longer time, right? According to that, we are going to identify the titanium. We have to take the titanium material or a ceramic material or a bioactive glasses which does not affect the body, okay, or used for their compatible and durability. In examples we can see in this diagram, we can see that we have prosthetic hand, right? Prosthetic controller we have been given in the hand. Residual limbs, implanting, how it can be implanted into the human body, what all the equipments it have, telemetry control. Okay, the normal this bionic arm, it can be told as prosthetic hand. Okay, that can be rotated in all the directions. Unlike the human hand, it can rotate in all 360 directions. Okay, in this left side diagram we can see that root canal procedure. Okay, these are the applications of the biomedical engineering which we undergo in the daily life. Thank you.